Community investment, otherwise known as place-based investment, helps create the social and physical environments that support community health over the long term. Hospitals and health systems are using this anchor mission strategy to address housing insecurity and other social determinants of health, and ultimately advance health equity. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hederle with AHA Communications. To learn more about the role hospitals and health system trustees have in championing and overseeing community investment efforts, Sue Ellen Wagner, Vice President of AHA's Trustee Engagement and Strategy, speaks with Kevin Barnett, a member of Trinity Health's Board of Directors. This podcast is part of AHA's series, Community Investment, Conversations with Senior Leaders.
Thank you for joining me today, Kevin. Trinity Health has made significant commitments to the economic health of its communities, including affordable housing through its community investment program. Can you speak to how Trinity Health leverages its financial capital by lending through this program to states with regional health ministries?
Sure. I would say for Trinity Health, this has been an area of focus for some years, well before I joined the board about 7 years ago. Like a number of other selected Catholic health systems, and with the strong support of the sisters on the board, this has been an area of investment for multiple decades. So it was an important consideration for me in the invitation to join the board that Trinity Health has this as a part of its portfolio, that it recognizes the potential to leverage the substantial investment portfolio that many hospitals and health systems have to help support, accelerate, and scale efforts to address the real drivers of poor health, what we now call the social determinants of health, what within Trinity we call the social influencers of health in our communities. So, looking at strategic ways in which we can support the community development community in targeting investments in areas such as affordable housing, healthy food financing, small business development, and general efforts to support the advancement of communities that are substantially negatively impacted by historical prejudice, as well as a number of other ways in which that undermine people's health and well-being in those communities. So it simply makes sense for health systems to look at ways in which to leverage those substantial funds.
Thanks, Kevin. And if we can elaborate a little bit on that, can you explain how the community investment program fits into the strategy within the Trinity Health System?
Sure. So I think for Trinity, like other health systems, there is a continuing learning curve in this arena. While hospitals and health systems have invested in the stock market in the more traditional arena for some time, entering into a market where, in fact, investments have not occurred historically for a range of reasons, in part because these are areas where of communities where investments typically don't go. So the emergence of the community development financial institutions at the regional and national level, as well as local community development corporations, and ways in which they are looking to expand availability of affordable housing. And as that understanding of the fundamental connection between living conditions and quality of life and health status, and subsequently health care utilization, as that understanding has built in the healthcare community, it simply makes sense to look at ways in which hospitals and health systems can support, usually on the front end of these efforts, providing low or no interest loans, and as well as often providing grants at the pre-development phase of these kinds of investments to help when there's not a funding stream, to help support improvements, acquisitions of land, to planning process, the development of plans, and to provide additional impetus as the community development community seeks investments by other sectors, the financial sector in particular, financial institutions in fulfillment of their Community Reinvestment Act obligations, as well as increasingly looking at ways in which to leverage local and regional public policies to prioritize these kinds of investments as it relates to the general funds of municipalities, and most currently looking at ways in which to leverage American Rescue Plan funds and other sources of fund from housing and urban development that are being made available to address the significant limited affordable housing that we have available and the inequities that we have across the country. I live in the state of California, where we have over 15% of the homeless people in the country, and dramatic shortages available of affordable housing, and significant proportion of our population that lives under the federal poverty line and lack a livable wage. All of these issues are coming to visit gradually, but assuredly, hospitals and health systems as we begin to assume increasing risk for keeping people out of our emergency rooms and inpatient settings as risk-based reimbursement expands. One can stand back as a healthcare institution and look at the field and say, well, that's not my job. But it is both irresponsible and it also, from a leadership perspective, reflects a lack of forward thinking and acting on behalf of healthcare organizations to not be engaged in this arena. Now, again, I'm not suggesting that these are problems that hospitals and health systems should solve on their own, but in each and every community across the country, hospitals are often the largest employers, and they're in a unique position to use their voice in a powerful way to help drive these kinds of conversations. In healthcare, we've always done a good job of engaging in the policy arena at the state and federal level. But the opportunity is now before us that has been heightened by our experience with the COVID pandemic to say and to begin to take a stand on a full spectrum of issues: access to early childhood education, quality of housing, access to affordable, healthy foods, and a livable wage are all direct health impacting issues that we need to address.
Thank you, Kevin. And, as you talked about Trinity Health's community investment program, I know a lot of that must be linked to the mission of Trinity Health. So definitely appreciate that. So, given this, community investment program, what role do you and other trustees on your board play in supporting and advancing the community investment program?
There is certainly plenty of inquiry and questions asked among the board and respective board committees about our portfolio and how we are looking at building that going forward. Trinity Health, I think, like a number of other systems that have some experience, such as Common Spirit Health, in this arena, I think increasingly are looking at how to ensure that both capital and debt, both investments and grants provided to communities and in support of community development are focused in particular in specific subgeographies where health inequities are concentrated, where social and economic inequities are concentrated. And that pushes our CDFIs and CDCs a bit in that their history is really looking at an opportunistic way at development that may or may not put that development that is needed in specific low-income communities where those health inequities are concentrated. So beginning to call for those investments to be more targeted, I think, has been an important development in the last 5 years in particular, that hospitals have begun to prioritize focus in these areas. For Trinity Health, looking at both how much we have invested in that arena, what are the spectrum of issues that we are supporting, and what our relative progress in that arena has been important. Between 2016 and 2020, Trinity had a focused initiative, a Transforming Communities initiative in 8 of our regions, with our regional ministries focusing on these kinds of investments as a part of a larger portfolio. And I should note that there's both that beginning to have that more subgeographic focus for investments. That dovetails closely with ways in which we are continuing to look at how to strengthen our investments in community health and ways in which we build a health network approach to how we manage the care of populations. As many are growing in their awareness, our approach to health involves how we better manage the care of populations, what we call a healthcare population health management, How do we effectively and proactively manage the clinical care needs of our populations? How do we step a little further upstream through the development of community information exchanges and the development of closed loop linkages with a broad spectrum of community based agencies, and where there is a lack of capacity to look at how to build that capacity? And last but certainly not least, coming to grips with awareness of the policy and systems and environmental dimensions of health. And that takes us into both the kind of investment arena that I'm talking about, but also really thinking beyond and making that connection. If we arrive at the fact that we have relatively high rate, for example, of preventable ED and inpatient utilization for children with asthma or people with diabetes. And if we geocode that analysis, this is important work that we do at the Center to Advance Community Health and Equity at the Public Health Institute. We do these kinds of analyses for hospitals and health systems and collaboratives of stakeholders in communities around the country. And you can see pretty quickly, first of all, if you start with an analysis looking at average household income and high school non-completion rates, in essence, as proxies of poor health in low-income communities, you see pretty quickly that these concentrations are typically in the communities in municipal areas where that were redlined going back 80 years ago. And they're still the poorest neighborhoods in these municipalities. If you then overlay geocoded analysis of what we call prevention quality indicators of preventable ED and inpatient utilization for things like diabetes, asthma, and cardiovascular disease, you'll see rates that are 4 or 5, and in some cases at the census tract level, 10 times higher than that for the larger county. So it points us pretty quickly to where we ought to focus. So if you are smart enough as a hospital to have and work with a team of community health workers that are doing home visits, and through those home visits, they begin to determine there is a cluster of absentee landlord housing complexes with multiple children with these issues, they can pretty quickly determine that those apartment buildings have 30-year-old carpets, have cockroaches, dust mites, have the kinds of environmental factors that are driving this. So it doesn't make sense to just try to address that issue on a one-by-one basis with each patient and then with each family, when often we determine that a housing complex is not in compliance with existing ordinances around healthy housing. So this is how we move gradually from individual patient care management to ensuring that people have access to the kinds of support systems they like, and then ultimately beginning to look at the environmental and policy and systems level at how to address that. That's an important part of the strategy for Trinity Health and increasingly for other hospitals and health systems.
Thanks, Kevin. Appreciate all of that information. And, as we sit here today, it's almost impossible not to talk about how the health system strategy has been impacted by both the pandemic and the social justice movements that have happened. Can you tell us how has the interest in your commitment to community investment changed over the last 18 or 19 months?
Given that I do this work around the country with hospitals and health systems, my inclination is to speak more broadly. I'm happy to say that the awareness of the profound inequities in our communities and the awareness of issues around racial injustice have, for the entirety of my time on the board of Trinity Health, have been issues that have been discussed regularly. I am struck as I have conversations with other healthcare leaders across the country that certainly one of the silver linings of the COVID pandemic is that it has driven home in a fundamental way just how inequitable of a society that we live in, and just how much we fall short ensuring that people have access to basically meeting their basic needs. We, in many ways, live with a delusion that we are a land of equal opportunity. This isn't about achieving equal outcomes, but we really need to grapple with how do we provide families and individuals across the country with an opportunity to succeed at the most basic level. That is much more discussed in boardrooms and among senior leaders across the country. Had a conversation with a CEO in a hospital in New Hampshire just a few weeks ago. We're doing a statewide project in New Hampshire through our Center to Advance Community Health and Equity at the Public Health Institute, and that is a partnership with the State Hospital Association, with the University of New Hampshire, and with community development groups. And the idea there is to develop a statewide fund for investment in the social determinants of health. Their conclusion was, we should do this together. We should link arms and look at ways in which to leverage our funds and to bring financial institutions, large employers, and the others to the table. And oh, by the way, we should build a common policy agenda across our sector and in partnership with the public health and community development sectors. That's quite exciting. And so we've been doing interviews with the CEOs of all the hospitals. This kind of firsthand exposure, I think, is critically important. It is clear that it also generates a level of engagement and understanding of what our leadership, our senior leadership of our healthcare employers can do to drive the kinds of discussions we desperately need to have in our communities across the country.
And, you're so lucky to have that great partnership that you talked about, because there's going to be great outcomes and great work that become of that. So we'll definitely have to stay in touch with you in that aspect. So as we close, what advice do you have for other trustees or healthcare systems who want to get involved in this work? And specifically, how do you suggest that boards really get involved in this work?
Well, that's a great question, and I will do my best to give you a relatively concise answer to that. My experience with boards has not only been having the privilege of serving on the board of Trinity Health, but I've worked as a faculty member for the Governance Institute for the last 14 years and have spent a lot of time speaking with and to board members and senior leaders around the country on these issues. And there's a particular need for our systems as we think about our boards going forward to ensure that we have the breadth of competencies on the board. People that are positioned to ask the kinds of critical questions that need to be asked. These questions are really strategic. The assumption of financial risk in the reimbursement arena is a real challenge for us as a sector. And we need people on our boards who understand what's happening in the public sector, who understand issues of evaluation and measurement, understand how to work with residents in communities, with community-based organizations, how to build an ethic of shared ownership for health in our communities. And so in that sense, our boards really serve as potentially, rather than as rubber stamps for more traditional approaches, i.e., let's stay out of those issues, let's really stay in our lane, to beginning to say, how can we begin to use our influence in a more positive way? How can we play a leadership role? Again, it's not our problems to solve on our own, but we have far more power and influence than I think we've effectively used. So our board members really need to begin to ask these kinds of broader questions. And we need to ensure going forward that we have the configuration of board members that are positioned to ask those questions in a thoughtful way.
The two key words that I'd like everybody to remember that you had commented on: shared ownership. And I think that's really what this is about. It's shared ownership to improve the health of the communities. So I want to thank you for being with us today, Kevin.
My pleasure.
We thank Kevin for joining us today and sharing Trinity Health's story from his vantage point on the board. And thank you to our audience for listening to this great advice that was shared. I encourage you to check out the other podcasts in our community investment series. You can find these and additional resources at aha.org/communityinvestment.